Again today. This is our first forum of the year. Happy New Year. The last time we met was in October. As you know, November and December, we don't have the forums. So today we have a lot of updates to cover. You have the agenda there. So I'll try to go fast at the very beginning to give you a general update, and we go through the rest of them. So this is on, right?
Yep.
Okay, first of all, I want to let you know that since the last time we met, we have been able to fill lots of positions. In October, when we talked to you, I told you that we had 8 or 9 vacancies on the org chart. So since then, I'm going to highlight the positions that we have filled. Let's see, starting from, I think it was here. Jessica came in actually right around the time that we met last on October 24th. Jessica is the new addition to the award team. Welcome, Jessica, to the team. There's Jessica. Yeah, October 24th. Then on the proposal side, we got Brooke in here, November 7th. Brooke, you're here somewhere. Okay.
Also, the Academy of World and a half.
After that, on November 14th, Janine came in. She is somewhere here too. So that made our proposal team whole. The same day on November 14, we had Grace came in. Who, she's sitting there. This position was vacant for a long time. You might recall that Randy Jenkins was in this position, and mid last year he joined Office of the President. So welcome, Grace. Grace comes in with a lot of good background. From one of the California State Universities in Fresno. She was in an office very similar to our office, taking care of contracts and grants. You would see her very soon. She was going to give a couple of updates. She, in addition to taking care of proposals, awards type of thing that we do, she's also being a patent attorney. She also took care of protection of intellectual property, and actually they were allowed, University of California, we are not allowed technically to file patents, but she was lucky enough that she could even file herself from there. So she's coming in with great background, and we are very happy to have her here. So those are the 4 positions that we filled since then. Now, as of Monday morning, this position is filled. So this org chart, I have it as of November. So as of February 1st, the new org chart will show that this position is filled, and that's Cassie sitting here. So that's the update in that area. Hopefully, I want to get rid of these green, the red ones. There are a couple of vacancies we have here. We have one here, and we have one here, hopefully soon. It has been challenging and difficult to fill all these positions. The type of background that is needed to be able to take care of the type of projects that we work with and to be able to provide good service to the campus, it's not that easy. And once we train people and they are good and they are doing good job here, somebody else from the campus or somewhere else take them, which in some ways it's good. We keep having more people and more connections around the campus. But anyway, that's hopefully we would have these other vacancies filled soon. On your list, we have the next thing that is on the agenda has to do with the new NIH mandated clinical trial reporting. I sent you an email on January 20th, and I thank the compliance group in the School of Medicine who put together a very nice summary of what the requirements are regarding the registration on clinical clinicaltrial.gov of all of the projects that they are quote unquote clinical trial. Cindy Gates is going to talk about IRB in general, so maybe we can start it now. She would be able to explain better than I do what clinical trial means for the purpose of this registration. So Cindy, do you have the microphone? Who has the
I
microphone?
can talk loud. Can y'all hear me?
Well, it's not only here, it's on the line.
Oh, no, I forget about those poor people. Thanks, Ahmed. So a clinical trial, how many of you think you know the definition of clinical trial according to NIH?
Oh, am I supposed to tell you?
Yes.
Oh.
You're on the spot,
I'm on
man.
the spot. So it has, let's see, for NIH, it's human subjects, it requires,
Is there any way I can see it here and not necessarily on
FDA
there?
drugs.
No. That's the problem.
If you don't look badly enough, I can see
Okay,
it
So
there.
FDA has a definition of clinical investigation. And clinical
The
investigation
person
is
who's
when you
talking.
have a human subject that you're testing a new drug or
That's good,
investigational
perfect.
drug or device in. A clinical trial, according to NIH, is when you have a human subject that you assign to an intervention to determine whether it works or not. And so, give you an example, we have a lot of studies ongoing right now where they're studying telemedicine. Does it work? And under this, some people are assigned to having the doctor there in person. Some people are assigned to having telemedicine. Some people are assigned to what they normally have is nothing because they live down a really rural area. Since they're assigned to an intervention, it's a clinical trial. Yes.
So then can you also explain what the phase 3 clinical trial is for the grants like packages where you have to mark yes or no if it is for NIH?
I don't know the phase 3.
Okay,
Clinical trial
because
stuff.
they'll ask if it's an NIH defined clinical trial, and then they ask specifically if it's a phase 3 clinical trial for NIH definition.
Okay, you'll have to look that one up. I know the
Okay.
FDA of phase 3 is with a drug or device, and they're using it in thousands of people usually rather than just a few. They're
Okay.
looking at the general safety, but I'm not sure what the NIH phase 3 means. So if it is a clinical trial, there's some requirements that really aren't new, but they're being enforced. And one of them is clinicaltrials.gov, that you have to post a clinical trial on clinicaltrials.gov. And now they're going to be enforcing it. They could be auditing. It is kind of a burden to do. Not only in some instances do you have to post it, but you also have to update it regularly. And when we first looked at our stats, we were really out of compliance. But we looked at other institutions' stats, and they were out of compliance too. And so we're not really bad, but we've got to get it caught up, because one NIH rep told me that if they find that we're out of compliance, and she said it this way, if one investigator hasn't posted the clinical trial on clinicaltrial.gov by the due date, they could hold all new funding. And so all these other investigators will not be happy with that one investigator if they knew who she or he was. But there's more information on what to post, how to post in your handout, but I just wanted to make you aware of it. And so in addition, if they're doing a clinical trial under the NIH definition, what's the NIH definition? What's the definition?
Tested new biomedical intervention in a small group of people from roughly 20 to 80 for the first time to determine efficacy and evaluate safety.
No, that's not it. Yeah.
Human subjects and intervention.
That's a clinical.
Human subjects in intervention. If you assign a human subject to an intervention to assess
Oh, that's
the
phase 1.
outcome.
Okay,
Yeah,
sorry. I have the phase 3 now if you want that exactly.
go ahead.
That is the study to determine the efficacy, I can't even say that word,
Efficacy?
of the biomedical or behavioral intervention in large groups of people from several hundred to several thousand, like comparing the intervention to other standards or experimental interventions, as well as to monitor adverse effects.
Yeah.
So
That's the
so
FDA definition, right? So the government is decided to require another thing of researchers and research staff, and that is GCP training. How many of you have ever taken GCP training? Anyone in here? Oh, Cindy has. Well, GCP training talks about the drugs and devices, how to store them, how they're supposed to be labeled, how you account for them, how you get consent, and all this stuff. And it's really not applicable to behavioral types of clinical trials. And so NIH did do a grant to develop some training for behavioral clinical trials. And that training got posted on the learning management website at UC Davis. And that just happened yesterday. And if you need to tell someone about the training, it's NIH GCP is the name of the course. And so to conduct a clinical trial that's funded by NIH, the investigator and research staff must have GCP training. And again, there's fines and penalties if we don't comply with that. So we're updating our SOPs and our website and all of that to let them know that this is available and that it's required. But if you can share the news, that would be good too.
It's required annually, required was to be awarded.
Every 3 years, I believe. Is it 3 years, Cindy? I think it's 3 years.
I think it's 3 years.
Yeah.
2,
3. Okay. It's one little, I got all these facts in my head. Yeah. So do y'all want the good news or the bad news now?
So that was the good news or bad news? The first.
Oh, that was news I can't do anything
Okay.
about. What, do y'all want to hear the good news? Okay, the good news is that for minimal risk research that meets some criteria, the IRB will no longer be requiring continuing review. The regulations have, for federally funded and FDA research, the regulations have required continuing review at least annually. And so if it's subject to a regulation, we've had to do this annually. Under the revised common rule that came out, they're not going to require it annually. They're not going to require it at all unless we decide it might be greater than minimal risk. But we've decided to jump the gun. And if research is not funded and not subject to FDA and a few other things, we're just never going to require continuing review on it again. And so it's a lot of work reduced for our researchers and their staff and the IRB too. So that's the good news. And maybe this isn't bad news, but we are going to be going through AHRP accreditation again. For me, it's not the best news because it's a lot of work for me, but accreditation involves the whole campus, not just the IRB. So there could be a role for any of you. They select random people to interview and when they're here and ask questions about their job and about human subjects research and protections. And so there'll be more on that news coming out. We're preparing a step 1 application right now, and that's due in June. And then it takes about a year to complete the site visit and get it all done. And then hopefully we'll have it done, be accredited or re-accredited in a year. One thing I didn't say about the clinicaltrials.gov is we changed our protocol template form, the 503, HRP 503, and it has an algorithm at the end of it that if you answer the questions, it will help you determine if this is a clinical trial or clinical investigation that needs to be posted on clinicaltrials.gov. Any questions?
Thank you. On this issue of compliance with the requirement of, thank you very much, Cindy, requirement of reporting, or having the information on the clinicaltrial.gov. As Cindy said, the sanction, most probably they are going to enforce the sanctions that they have been saying that they are a part of this whole thing, which means that if one investigator has not met the requirement, they are going to hold awards, which means that if that happens, usually from time to time, the campus is threatened by those type of things. What I have to do then, I have to make sure that the PI knows it, who is not complying, and immediately I let their chair know. And I would tell them that within a couple of days, I have to let the dean know. Because everybody on campus has to hear that, it is something serious going on. And up to now, we have been fine in other areas. And usually in those situations, the report's coming real fast and we take care of it. So be careful, tell your researchers that this is extremely serious. Cindy is
Sorry.
here. Now we have a second
Interrupting,
Cindy.
And I asked Cindy to stay just a few minutes longer because there's another thing happening in the IRB world with the posting of the new regulations, as well as 2 notices that we received from NIH a while back. Oh. Like a karaoke star.
Okay.
All right. So the other thing that's happening with the IRB, we received 2 NIH notices, and it has now shown up in the new regulations. And it's a thing called single IRB. Everybody faculty thought this would be a great thing, and they were so supportive of it. We'll see how they react now to how we're going to have to implement these things. So NIH initially sent out a notice that says for certain projects, you will have to, so collaborative projects where you have more than one site, so university, UC Davis and someone else, Harvard, we're collaborating. Now you have to decide who's going to be the lead IRB and who's going to be a relying IRB on these kinds of studies. If UC Davis is going to be the lead IRB, a second notice that came from NIH said that we can direct charge to the budgets the cost of being the lead IRB. And that's how we're supposed to do it, according to them. Initially, their notice said we had to start doing this by May. Any proposals submitted by May and afterwards had to use this mechanism. They were going to update their budget mechanism so you could start costing for this upfront in your proposals. They have not done so, so nobody seemed to be prepared for May. It was just too soon. We were able to talk them into delaying implementation until September of this year, or 2017. So now we have to be in compliance by September 2017. Right now, IRB's been working with Mike LeGrand to figure out what does that costing look like, right? And how do we know what each action costs us because we've done a few pilot studies at the IRB with being the lead with multiple sites. And what we've discovered is the costing is going to differ if it's a minimal risk study versus an at-risk study. And it depends highly on how many amendments, changes to informed consent forms, those kinds of things that happen downstream after initial approval. We know what each action costs us, but we don't know how many times those things are going to happen. So how do you guesstimate up front in a proposal when you don't know those things for the future? And so Mike LeGrand, I think, took it to the recharge committee group to kind of have a discussion about how to solve this, and I haven't talked to him about it since then. So we're working those details out, but a lot of folks are saying, a study could be $50,000 if we're the lead. So this is not an insignificant budget amount, and it's going to be direct charged to your budgets. So this is coming in the future. The other aspect of this is that if we're a relying institution, so someone else is the lead IRB, our PIs and our departments are going to have to learn not just our IRBnet system that we use, you're going to have to learn the system of Harvard or the system of whoever is the lead institution. So now our faculty are going to have to, if you're a prolific faculty member, You might have multiple systems, IRB systems you're working in with multiple passwords and different forms that you have to fill out for the different IRBs that are different than ours. So really, this is going to be a proliferation of administrative burden for our faculty, in my mind. So they thought it would be a streamlining kind of thing, and in reality, I think it's going to be kind of difficult for our faculty to do this, either as a lead institution where we're charging for the work, or a Reliant institution where they're going to have to learn up somebody else's system and forms and processes and policies. So this is
Is the good
This is-
news or bad news?
this is just, it just is. It just is. We're going to try and do it, and from a costing perspective, that we'll do it as cheaply as we can, right? Some institutions said that they did not want the hassle of being a lead IRB, and they've decided, such as Emory, has decided to go with only commercial IRBs. If you want them to be the lead, you're just going to go through a commercial IRB. They didn't want the hassle of the costing and the, that kind of thing. So different universities are taking different approaches to
But the
this.
cost is there anyway.
The cost is there because you're going to have to pay the commercial IRB out of your
More
direct cost
expensive.
budgets, and it's probably going to cost more than if we do it in-house. That was our assessment, that it's going to cost us less if we do it in-house instead of farm it out to a vendor. So even though it's a lot of administrative hassle. So anyway,
So we have to enforce the budget issues once all of that is known.
so once we know the costing mechanisms but if you want to do something before September, right? If you want to send out a proposal where we're the lead IRB, please, please, please make sure you get in contact with Cindy Gates ahead of time. All right? Because you could put a budget item into like your other budget section or something like that, but please negotiate that with the IRB before you just agree, yeah, we'll be the lead. Okay? So that we can manage that whole piece.
Okay.
Anything else, Cindy? Did I miss something?
No, that was better than I could.
Well, okay.
Any questions from here or online? I don't see any questions coming online either, no.
There's a 15-second delay.
We need music. We need pause
You
music.
know how to sing, go ahead.
All righty.
Thank you very
Thanks.
much, and have a safe trip to Sacramento. Okay, let's keep moving. The next item on the agenda we have is research compliance and integrity. Craig Ellison. Thank you, Craig.
Thank you. Thanks, Glenn. Good morning, everybody. So some familiar faces, some new faces. I am Craig Allison. I'm the Director of Research Compliance and Integrity. This is on. You can hear me okay?
Yes.
And my unit, as you know, covers a lot of areas. I'm going to talk about COI real quick, kind of more of a heads up. But so as at least the older folks know, in 2012, when PHS came out with its new rules, we locally developed a homegrown PHS COI filing system, right, since 2012. We've had tremendous feedback for the most part, more user-friendly, more efficient. So the bad news is, though, I got notice from the Trump administration that we have to go back to paper-based wet signatures for all of our PHS filing. A little research administration humor.
It's April 1st.
Yeah.
They would come down. They would discuss it.
Look at that. Anyway, so yeah, no, anyway, just want to make sure you were paying attention. Actually, I have great news. And really, this is really at this point more of just a heads up because we aren't implementing the whole thing, but it similar to the PHS electronic disclosure. Well, actually, there's two pieces of it. First point is all of our COI disclosures soon will be electronic, including those dastardly 700Us that are a major pain, right? Yes. And it's taken a while. We've wanted to do this, and our team has been working on this diligently through IT with Tim Holmes, Sherry at her lead. She's the one that was doling out hugs earlier, free hugs. But anyway, it's taken a while because the 700U process, as some may know, is governed by a state agency, FPPC, and we had to get authorization from them to go electronic. They looked at security and that kind of thing. And so we got that finally. It took them a while, several months to look at it and tell us, but we finally got that. So we're one of 2 campuses system-wide that now has authorization and approval to go electronic with our 700U filing. Right now, we're in the process of essentially doing some piloting. We're developing a fairly comprehensive user guide. Again, most of you probably at this point are going to look at the user's guide and say, this is way too basic, I already know it. But I want a user's guide that, 5 years from now, somebody new in your department can look at and just track through it and know how to do it. So with respect to PHS, we're moving that over to the new platform as well. Some of you may have seen it if you've gone into it. I should have bought a slide, didn't matter, but you'll see the PHS file. That's essentially the same thing. It's look a little bit different, but it's the same question, same process. You'll see on that page, 700U, the Form 800, and it'll say on there, I think it'll say on there, coming soon, right?
Right.
So that's the case, coming soon. You can't get into that yet, but I wanted to just let you know that we will, at some point, I'll probably come back, I don't know, maybe the next meeting and say we're now live. But again, so I have good news this morning, right?
That's good news.
Yeah.
And also one thing that you might have not noticed, this is the new uniform for Office of Research.
Yeah.
Okay, thank you, Craig. Accounting, James.
Thank you.
I suppose so.
I was so impressed by Ahmad's presentation of the sponsored programs website. I thought maybe we'll bring that up because I did want to.
It'll take 10
How do you type? Yeah, that's okay. You
let's
can
do,
type.
can we do accounting.UC Davis?
AFS.
AFS. No, I'm sorry, just AF.
It'll take about a minute for the projector
Okay,
to
one.
come back on.
Dot UC Davis.
Like this.
Dot.
Okay, good.
Okay, sorry for the delay there. So similarly to the positions that have been filled in sponsored programs, we've been making some really good progress in contracts and grants accounting. We have seated several new fund management analysts. So we have Daniel Chang is a new position, Regina and Kathy just started on Monday. Stephanie Macy Gallo joined us within the last month or so. We have Trent Montgomery that's joined the compliance team. We'll introduce him in a little bit. So lots of things are filling in, which is good news. And thank you for your patience as we've been trying to get back up to being fully, close to being fully staffed. I think we have another person coming in pretty soon. So this is all very positive. Even hopefully more positive on the whole. I'm sorry, again, thank you for your patience as we did work through this. But we have introduced a new team or sub-team under Deborah's
James, could you come here and
compliance.
mark it here?
Sure,
Because they won't see it there otherwise.
sure.
If you-
Oh, if I'm just waving my
Yeah.
hands, the folks can't tell what I'm pointing at.
Yeah.
So right here, we have two folks that we are tasking with quality assurance role. So this is a new process that we're implementing. What that means, they're going to be looking at several things, but one of the key things they'll be looking at is they will be doing a second look at new award setup so that we will make sure that we've got good data in our system from the beginning and we don't have situations where, perhaps some of you have had the situation where we have an award that's been set up and 6 months or a year or some point down the road, somebody says, wait a minute, this is federal money. And then we go, oh no, that's a problem. And the only way we can fix that is to shut down the existing award, create a new award in the system, and then go through a bunch of transfers. You know how transfers are not a good thing. So that's one thing that we'll be looking at is the new awards that are being created. And then we'll also have a function that will be, to look at amendments as they're coming through, and we'll have a function to look at the closeouts to make sure that we've got everything all squared away on the closeout side. So this will be, on the whole, a positive. We're just getting this rolling right now since we've got our new fund management analysts coming into place. Nikki and Deborah have moved out of the fund management teams and over to the compliance team with Deborah Henn. Too many Deborahs. Deborah Thomas, Deborah Henn. I will say, though, that, so that's, on the whole, this is a benefit, I believe, for everybody. It probably means that it will take us a little bit longer to get it through the QA review so that you get the notice that says it's time to go create your expense account to go with this new project. Same thing as always, though. If you've got something where you need to have something set up quickly, just give us a call, send us an email. We will prioritize that so that the fund management team gets it set up. We'll let the QA folks know that we need to rush this through. They'll do the review as quickly as possible so that you can get your new account set up and your payroll distributions, whatever the preliminary steps are that you need to do. Does that sound interesting to everybody? Let's see, what else am I gonna? Okay. We are just about completed with our first single audit under the uniform guidance. We used to call it the A133 audit. Now we'll just call it a single audit. It's a single audit of all of our federal funds. For the most part, things like we've worked through numerous issues, but I think we're going to be okay for the most part. There's one issue that we do need to work on. We've started figuring out how we're going to do this, but I'd like to give you a little heads up on your vendor invoices really for everything. But when you're processing vendor invoices, especially for our subcontractor payments, subaward payments, please take a look at the payment terms. When you're paying, the payment terms should be net so that the payment will occur immediately. We're still working on the analysis, but some of the awards have been set up, or subawards, NPAs have been set up so that it's some other payment term like a net 30. We don't want that. We don't want to hold that payment for 30 days. We need to get the payment out the door right away. Two reasons. One is uniform guidance says that we need to get those payments done promptly, and the other is we need to coordinate those payments with our cash draws that we're pulling down from the federal payment systems. So if you just put that in the back of your mind when you're processing your invoices, and I believe you can control this on your side when you're putting doing the PRECs. Look for the payment terms, set it to net if it's on a contract and grant sponsored project. We're looking at some other maybe business rules to try to get it so that the system will take care of this automatically. The ones that might sneak through, we're going to do everything we can to try to get those fixed before they go to final status. Okay, does that make sense? Questions, concerns thus far? Okay, I think that's my points in a nutshell. However, I would like to ask Deborah Henn if she could give us an update on our status with effort reporting cycle this year and perhaps introduce a new companion we have in our office.
Good morning. Hi. So before I talk about our new compliance analyst, I just wanted to give you all a quick update or reminder if you've already been notified. We have had an upgrade to the cost share tracking system. So we now have a screen called Other University Contributions, and we're able to enter in cost share for things like waived indirects and waived fees. So some departments have recharge rates and things, and they're waiving their fees and calling that cost share. We formerly haven't had a place to put that in the system, but we recently had a review done by Amy, I can never remember the darn name, Audit Management and Advisory Services, did a review of our effort and cost sharing systems and processes. And it was recommended that we have all of the cost share in the system so that we can have a proper evaluation of how much we're actually cost sharing, which would be a nice thing to know, because I think some people will be shocked. So if you are not sure about how to use that new screen, you're welcome to give me a call, or you're welcome to call Trent Montgomery, who I'm just about to introduce. He is our new compliance analyst, and he's been here with us since the beginning of December. He's already got a really good grip on the whole effort reporting process as well as the cost share processes. And he's the one who's now processing the salary cap reviews every month and sending out notifications, and the looking for late transfers that are done in PPS. So those are just a few of his responsibilities, but I'm going to go ahead and let him talk about the effort reportings.
So, does anyone know what's due Monday? If your first guest is certified effort reports, you're correct. As of yesterday, we have a 90% certification, 90% of outstanding effort reports certified. There are just over 700 still outstanding. So if you do have an outstanding effort report in your department, please take a look at it and get it certified before Monday. If you have any questions, we do have extensive explanations and guidance on the Contracts and Grants Accounting website, or if you have any questions, feel free to email or call me. We also have a help desk, ershelp@ucdavis.edu if you have any questions. And also just a reminder that faculty should not certify for other faculty members. And we're still seeing it. We do still see it. And if you have, the most common question or issue that I've seen come in over the past few weeks are what happens when a faculty member or someone with an effort report is departed the university and can no longer certify their effort. What should happen in that scenario is you need to find someone who has firsthand knowledge of the effort or work that was done on the grant. Usually it's up higher in the chain of command for the project. And you need to complete a certification form, send it to us so that we can have a record. But again, if you have any questions, please give us a call or shoot an email. Thank you.
Anybody have questions about the reporting? Remember, if you have reports on exception status, you need to take action on them. If you're not sure what you need to do, go ahead and give Trent a call or send us an email at ershelp@ucdavis.
Okay, thank you. Sherry, update on database and.
Sorry, I forgot one person. I know, I saved the best for last. Okay, good morning. I'm Sherry Pulis. I'm the project and business analyst here in the Office of Research. And my main responsibility is to work with the IT team in managing the project portfolio for all the IT projects that we have going on. And what we're currently working on right now is we want to continually streamline the research administration proposal and award process. For those of you who don't know, we are no longer using the Koali-COIUS product. We have moved over to CAIUS. And what we have in production right now is the CAIUS 424, which is for the grants.gov submission. So for those of you who have been using that, we're going to now implement the CAIUS SP, which is the proposal process from cradle to grave. It'll cover everything. And this will actually integrate with the CAIUS 424 as well. One of the updates that we will have coming, for those of you who use the CAIUS 424 system, you probably know that if you need to put someone as a PI on the proposal, they have to have had logged into the system or else their names didn't appear. Well, with the CAIUS 424, we're actually loading all the information ahead of time, and it's going to go ahead and create those professional profiles for you. So the users don't have to log in. You will see them in the system. Once we start getting closer and closer to implementation and kind of figuring out how we're rolling this out, we'll be communicating all this information to campus. So it will integrate with Cayuse 424. You will see a new screen, a new interface once we implement this. And we've created focus user groups. We have a focus user group, probably about 35 individuals, and it's covering everyone on the campus, all the different departments, colleges, and they have been meeting on a monthly basis. Right now, we're going through user acceptance testing. So we have our testing system, and we are now uploading all the users, which is, I don't know what the number is. I think we're up to like about 15,000 individuals. So they're having to do a lot of verification to make sure all the information gets in there correctly, their titles, their departments, et cetera. And we're also working on reporting and the feeds to campus. If you want any additional information, you can go to the spark.ucdavis.edu website. We'll be uploading information there regularly. And also we're working on our communications campaign with our Director of Marketing Communications, AJ. The next article that will come out will be on the Dateline, and we're shooting for this Tuesday since it comes out every Tuesday. So that will have updated information in there as well. If you have any questions or any comments, don't understand anything, you can email me, and it's just KS Pulis, my last name, at ucdavis.edu. Any questions? I know there's a 15-second delay. 15 seconds seems like forever when people are staring at you. Yeah, no, you don't want that. No.
No questions here either.
No questions? Okay,
Yeah.
perfect.
Okay, thank you. Update on proposals, Chris and Bridget, the team leaders for proposals. I know that Bridget is going in and out.
Yeah, she
she's
just got
submitting.
called away. She got called away, so.
She was sitting here and she was working on submission of proposal while she
Yeah,
was sitting there.
Yeah, because the proposals still have to be submitted, even though we're here in this meeting today. So thank her for that, definitely holding down the fort with that. Good morning. Welcome. Happy New Year, by the way. This is our first meeting since October, so thank you for all coming. It's great to see everybody here, to see a full house. This is wonderful. Hopefully this momentum continues. For those that are online, thank you for joining us online. Again, as Ahmad said, I am Christi Hicksonbaugh, and I work with Bridget Round-Strong, and we are the officers that oversee the proposal team. We serve the entire campus with all the proposal submissions. We have a wonderful staff of 9 people. As Ahmad showed you, we are fully staffed, knock on wood. So hopefully we are meeting your needs more than ever because we have permanent people in places right now. So I wanted to update you on a couple of things. One thing that we're seeing recently was with the new year, we have a lot of advanced account requests coming in. A lot of funding starts January 1. So faculty and researchers are looking to get those projects started because they don't want to fall behind. So there's a request coming in for advanced account requests on those projects that they've already been selected or notified that they're going to be funded. But because whatever the agency is taking a little bit longer to get those awards out for those effective dates, they're saying they're going to start January 1. It's now January 25th. The funds haven't come in. They're asking for an advance account. When we do the advance account, when there's no award, our office is responsible for ensuring all of the compliances are met. That means human subjects, animal subjects, and compliance with the conflict of interest. Thank you. I wanted to say Form 800 so bad, and I know that's not right. Anyways, what comes up is the Form 700 most frequently. People are thinking that they don't have to do it because the award's not here. Well, technically the award is not here. However, as soon as that faculty or researcher expends that first dollar, we've now committed to the terms and conditions of the advance of those fundings in anticipation of that award and the award terms. So it's really important to understand, to help the faculty understand that the conflict needs to be met before the funds are expended. So that does mean that you do have to fill out your Form 700 if it's applicable on those research projects. If you have any questions whether or not it's applicable, feel free to call our office and we can help you with that. Hopefully, like Craig said, that soon the online will be coming and it'll make it a lot easier for the faculty to do that instead of the required wet signature that is now the standard. So Again, if there's any questions, please feel free to give our office a call. We're here to help you the best that we can, but those forms are required at the advanced account stage 2. Is there any questions about that? Great. The other thing is, it's a new year. We're 1 year in with the state model agreement. Woo woo!
Okay.
I know. It's the little things. I don't get out much. I do proposals all day. So with the state model agreement, we are 1 year in. So this is a good thing. People are coming around at the state. They're getting to know us. They're understanding. We're being repetitive. We're telling them this is what we have to follow. It's on your website. Please follow it. So they are slowly doing that. And now what's happening is projects are going to be funded. Well, with projects being funded, they need us to comply with what we're telling them that they have to comply with, which is the exhibits. People are like, what? I didn't have to do the proposal phase. It's true. It is not a requirement for you to submit all of your exhibits and the cover sheet at proposal phase. However, we highly recommend you do, because it will save you time in the long run when the award comes in. Because right now, we're doing a lot of revised budgets, which is great. That means funding is going to be coming. But we have to also do all the exhibits in the application package too, which takes time and involves the faculty and the researchers, and they don't always have that time. So things are getting delayed. We're trying to get them in as soon as possible so that they can turn around the award with all the exhibits. The exhibits are located on our website as well as DGS's website. If you have any questions about what exhibits to complete, how to complete them, our office is here and available. So one of the things to remember with this new year, the new indirect cost rate will be effective July 1, 2017. That means it goes up again another 5%. Not again, this is a first increase. So it'll go up its first increase July 1, 2017 from 25% to 30%. What this means to you, your faculty and researchers, is that any proposal that you are going to submit for a start date of July 1 or beyond that, your proposal needs to have that 30% indirect cost rate based on modified total direct cost in that budget. That
Just
is
a
requirement.
footnote on that. Grace is going to talk about an exception to that
Right.
25. So just hold on there that, you know, the 30% is right for generally for
General
state. We will talk about the exception in a
Exactly.
couple of minutes.
Yes. Yes. Any proposal that is has a start date of July 1 or beyond,
With the award,
the
the
project
project
start date. Not submitted July 1, the project start date requested in your period of performance.
Right.
Thank you for that clarification. It must reflect that 30% modified total direct cost. If you hear TDC, TC, you are incorrect in the information that has been received. It is MTDC, modified total direct cost. Is there any questions on that? Yes.
Does that affect all of their costs?
No.
No, this is only
No,
state.
this is
We are talking
only
about
state.
state only.
Sorry, thank you for that. Yes.
If they get a, no cost extension on the current, so we have like an exception, so we're actually at 17.5. But if they get an extension or an amendment, we can have to be.
Let me take that.
Yeah, and I would verify the exception.
Yeah, just there is, I mean, you have to be very careful about this. In any of these areas that we are talking about, if it is proper no cost time extension on the money which was already committed, that's a different issue from an award that we have had it for 3 years. Now they want to add a little bit more money. New money is going to be subject to new indirect, no matter how you look at it. If it is old money, it would stay, not 17.5. Go ahead, no, you want to say something about that?
The other thing is, it was mentioned that she has an exception of 17.5. It's not an exception. There's 2 cases where 17.5 could be applied. And that would be under an existing Caltrans project
Right.
that is being, like she had mentioned,
Mhm.
extended, or it's possible that it could be a CESU. So it's not an exception, and it must be stipulated in the call. If it's a CESU, it must be identified that a CESU master agreement mechanism is going to be issued as part of the funding mechanism of that project. And those that are members of the CESU get to use that rate of 17.5. Now, there's 2 exceptions to that rate. And it's important to understand that.
This is the exception to exception.
I know. Because why? It just is.
That's how it is.
So with that exception, under the CESU, there's two determining methods of factoring the applied method of that 17.5. If it is a USDI, Department of Interior, that methodology is based on modified total direct cost. What I mean by that, by method, is that when you apply your 17.5, you do modify your base, then apply your 17.5. If it is not a USDI, US Department of Interior, which is USGS, Bureau of Reclamation, Land Management, those are under USDOI. If it is not one of those agencies, the rate is applied as total cost.
So if you have any questions on any of these, you really have to call us rather than guessing and using improper indirect, and you have to adjust it at the time of award that nobody's going to be happy maybe.
Right.
So talk to us. We would work with you to make sure that the proper indirect is there.
Right. What Bridget was going to talk, oh wait, no, really quick before I move on to the deadlines. For those of you who are not aware, NSF has a new set of guidelines for their proposal and award policies and procedures guide. It's called the PAPPG. Say that 10 times fast. It is effective next week, January 30th. This is effective. It is NSF 17-1. That is your overarching call for guidelines and award administration proposal submission, everything you want in one document. It tells you how to submit your proposal, what you're supposed to do in submitting and preparing your proposal. It tells you how to manage your awards. This will be effective for any project that you are proposing January 1 or beyond. So, or January 30th, sorry. January 30th or beyond.
So if you have any questions, call our office.
Yes.
So it's January 1 or January 31st.
I won't be here January 1st, so I'll get back to you. Anyway, there is a list of changes, and I don't have them with me, but it is on their website. If you look up the NSF 17-1 list of changes, it'll identify. One of the things that it's really important to make sure that you're paying attention to with NSF is any the changes for biographical sketches, for conflict of interest, information that they're asking you, as well as the collaborators and other affiliates. Those are items that have recently changed over the last year or a few months. And so it's really important to pay attention that the faculty and the researchers are following those guidelines when they're preparing their proposals, their biographical sketches, and inserting information under the collaborators and other affiliates section. No, FastLane is under what they call a modernization process. FastLane is very old. I will not tell you how old because it dates me. So it is a very old system, and it is a system that has shown that it will not stand the test of time, and they are trying to modernize it with research.gov. And so you'll see a lot of changes going on, and slowly they're implementing more awards transactional items through the research.gov component, as well as they're trying to move the proposals over to research.gov, but that has not been implemented, and they're only testing it as far as I know right now. I don't know when they're going to actually do the crossover. So other than that, we have lots of deadlines. For those of you who are not aware, today is a deadline. So not a lot of our proposal staff is here. They are preparing and submitting proposals. Some of them are in the back, trying to slide in and out. Thank you for joining us, guys. The other major deadlines coming up right now are the France Berkeley, which is at the end of this month, and the Uniform Grant Consortium with Viticulture and Enology, also known as the GRAPE Consortium. That is also due at the 30th. We have a lot of proposals for that. We have a lot of proposals for the marketing boards that are coming in with the new year. So if you have any questions about marketing boards, feel free to call our office. And then we have the huge deadline coming up for NIH, which is February 5th. One note to identify, February 5th is a Sunday. Because the deadline falls on a weekend per the federal policy and NIH's policy, you are allowed an extension to the next business day. So your proposal is not really due on February 3rd, it's due February 6th. If you prepare a data sheet and that data sheet says February 5th, the data in our system will be entered for February 3rd. The reason being is that we cannot have a deadline on a weekend. And in order to ensure that there is no deadline missed, that deadline will be moved to that sooner business day rather than the later business day. I'm telling you this so that you can prepare your data sheet to say February 6th instead of February 3rd. Because what will happen is if it says February 5th, it will be logged in as February 3rd, which is a Friday. And already we've had a number of phone calls and emails of concerns that people are saying, well, wait a minute, the deadline's not until the 5th. Why is it entered at the 3rd? Because we cannot miss a deadline. And because it says it on the data sheet, we cannot change the data sheet without your approval. So it's important to know that federal regulations that have been stipulated by that sponsor that says if it falls on a weekend or a holiday, it moves to the next business day. So the deadline is truly February 6th. Is there any questions? Okay. All right, so.
Thank you. I don't see any questions.
Mike, do you have anything to add? All right.
Very good.
Thanks.
Thank you. Okay, the last part of our agenda, Grace. Again, as I said, Grace is the new member of the team as of middle of November, November 14. She assumed the position of Associate Director responsible for awards, counterpart to Mike, who is on the proposal side. But that doesn't mean that that's not their only responsibility. They back up each other too. So they are the two associate directors. Grace comes here, as again I said before, from California State, Fresno. She has background in proposal preparation, submission, award acceptance. She has the CRA, for example, too. She's a patent attorney, and she took care of management of their intellectual property, filing patents, and so on and so forth. So she comes in with a lot of good background. Welcome to our team.
Thank you.
And the updates that you want to have, please.
Oh, thank you. It's great to be here at UC Davis. All right, I have 4 things today. I think Cindy alluded to one earlier. So the Trump administration is getting right to work, and they've imposed a freeze on grants and contracts by the Environmental Protection Agency. So how many of you are in departments with EPA funding? Okay, Kelly. All right. So what does the freeze mean? We're still trying to figure that out a little bit, but from what we can glean, we think it means that it applies to grants and contracts not yet obligated. So if you have funding that's already secured through an executed award, we don't believe the EPA is going to refuse to pay their bills. We believe that this means that they're not going to execute new awards. So if you submitted a grant proposal to the EPA, you're probably not going to get that award for a while. Okay. So and if you have a contract that you're expecting, it's not going to be forthcoming for a while. Yes, Kelly.
So what about like an amendment that has additional funding?
Could you
I don't-
repeat the question, please?
Okay. The question was, what happens if you have an EPA amendment with new money coming in? I don't think that amendment's going to get executed right now. I don't think new money is going to be obligated anytime soon. Okay. So UCOP has not issued us any directions on how to deal with this. We will keep you updated as we can. And there will probably be other agencies affected soon. Okay, I'm expecting USDA to be affected soon too. But
Yes.
right, so it's kind of like breaking news around here, you know, with this. Okay, the second thing I wanted to remind everybody was there can be no state funds used to travel to the following 4 states: North Carolina, Tennessee, Kansas, and Mississippi, right? No state funds can be used to travel to those states. And then also the last 2 have to do with indirect cost rates. So as Ahmed and Chris said, usually for state agencies, the indirect cost rate right now is 25% MTDC. Cal Department of Food and Ag is a state agency, but they are an exception. They are starting off at 10% MTDC with 5% incremental increases. So right now it's at 10%. If you're submitting a proposal to California Department of Food and Ag, your applicable indirect cost rate right now is 10% MTDC.
Unless if the start date is after July 1st.
Right. And the escalation starts on July 1st. So if the project start date starts July 1st or later, then it will be 15%. Okay, and it will go up 5% each year on July 1st until it reaches 40%. That was the agreement reached. So it's 25% for most state agencies, but it's 10% for California Department of Food and Ag. Are there any departments here with California Department of Food and Ag funding? Any ag people? Okay. And then the other one is marketing boards. Okay, by what we mean by marketing boards is it has to be on a list of a state or a federal registry. Just because somebody calls themselves a marketing board doesn't make them a marketing board. It has to be recognized by a state or federal list. Okay, so marketing boards are kind of industry interest groups, all right? And UCOP has negotiated an indirect cost rate that's 0% MTDC through June 30th, 2019. Okay, so for marketing board money, it is 0%. Okay, but marketing boards are a very narrow exception, and it is only for those that are listed on state and federal websites. Okay, are there any questions? Yes,
Is that
Brian.
any state or just California?
They are, at this point, I believe it's California marketing boards. And there are some other states that they have marketing boards, obviously, but these are really applicable to California marketing boards.
Okay,
Which is money
California.
from California.
Yeah.
Okay.
I don't think we have,
These are from the Oregons.
yeah, Oregon, sweet, right, and apricot is from Oregon, if anybody works on apricot.
Okay.
Okay.
Any other questions?
The concern here that we had, Grace is explaining that they have to be on the list, is that the way marketing boards work is that the growers basically tax themselves, and that's how the money is generated for this research, this type of research. There are, as Grace said, there are state marketing boards, state recognized marketing boards, and they are governed by California Department of Food and Agriculture, and they are federal level marketing boards that they are under USDA. So if they said these are marketing boards, that's what we have to follow. There are some other entities that they get together and they behave as if they are marketing boards, and in good faith they collect their percent of their whatever income, sale or whatever, and they behave like a marketing board. That doesn't make them marketing boards. So we do have several examples of those, that the PIs, they get award from those entities and they think that 0% would apply, and no, it won't. So there are some of those cases that the money comes through CDFA. Again, marketing board money from the state of California comes through CDFA, so it's 0%. But these other quasi-marketing boards, money comes from CDFA, it's 10%. It's the general rule of indirect that we have to apply to CDFA. Hopefully that makes sense to you, which would increase to 15% effective July 1st.
Yes.
Hi, could you back up to the state funds travel? You said North Carolina, Tennessee, and what was the other ones?
Kansas and Mississippi, the four states.
And do you have, why? Do you have
Okay, yeah, let's just, these are the states that they have some rules in place that they are in some way that the state of California has concluded that they are discriminatory. Like Carolina, you know about the rules regarding use of bathroom and so on and so forth. These are, in California, they are not recognized. They don't believe those rules should be on the books. So these are the four states. The way actually the direction is that I believe it says something to the effect that we cannot require somebody to go to one of these states, and if he required to go there, then no, we can't pay the cost of the trip. That's basically what it is. But to be on the safe side, most places they are saying that we can't use any state money to travel to those four states at this point. Now, the four again.
North Carolina, Tennessee, Kansas, Mississippi.
There was,
Kansas.
yeah, they have similar rules in those two. They're on the book, right? There was some speculation that the list might increase, but as of January 20th, it might decrease. So we don't know, but at this point, there are 4 of them.
What happened to California?
There was a petition to make it 6 different states last year or a year and a half ago. I don't know. California is 7th largest economy of the world right now. It's a country. So I don't know what that means. So maybe you would be the president.
Probably wouldn't qualify.
That doesn't, that's not
Is the YouTube stream still live? Okay.
Well, maybe I would. It would be huge.
Let's make California great again.
Okay.
Okay. Any other questions? All right.
This room is getting really warm here. Well, thank you very much. It seems like, let's see, any questions on any subject other than the ones we can't answer? Oh, the audit, come on over, Amy. Amy, come on down. Here's Amy, our favorite person in the audit.
Good morning. If you don't know me, my name's Amy Holzman. I am the External Audit Coordinator for the UC Davis campus. So what that means is if you are contacted by a sponsor, you might be contacted, the PI might be contacted, SPO might be contacted, Contracts and Grants might be contacted. If you are, and they want to audit you, give me a call. So I will help guide you and I will help coordinate our work, and I will also be the central point of contact for everybody here and also the sponsor. And we have 2 audits right now going on with the California State Auditors, and they really highlight the value of having one single point of contact because they don't like to use me as the external audit coordinator. And so what happens is they go on the directory on the website and they say, oh, well, let me contact this person and this person and this person. And they contact 4 or 5 people and ask for the same information. And what do they get? 4 or 5 different people giving 4 or 5 different answers, but then also scrambling to give them the same information. Eventually it comes to me, but at that point, everybody's expended a lot of time. So if you get contacted by a sponsor for an audit or a review, or they could call it something else.
Site visits, for example.
Hmm?
Site visit.
A site visit. If it has anything to do with the finances or the administration of your award, that would be something I would be involved in. If it's a site visit that's truly only programmatic, it's only about the scientific aspect or whatever the aspect of research that you're doing, you give me a call. I don't know necessarily that I would be involved because that's not necessarily my area of expertise, but nevertheless, give me a call. So I'm up here to give you a quick update. So the first one, NSF, system-wide, nothing. They've been radio silent now for, I don't know, 4 or 5 months. So the last I talked with the audit manager on the job, he said, no, we haven't forgotten about you. And we still plan on issuing a report. It'll now be on data that's 7 to 10 years old. Yeah. But yes, so be happy that your UC Davis, oh, we're going to go by a new name. We're going to try this out. What do you think of Aggie Audit? But we're Audit Management Advisory Services. That's my home department, so I wear a dual hat. I'm also a principal auditor. Where was I going with that? See, I like the Aggie Audit so much, I totally forgot. Yeah, NSF, anyway.
No news.
Pardon me? No news on that.
What was the last number that they were, was it 10 million or something? What was the last number that they gave us?
I think it was like 3 million. Wasn't it something like that?
Yeah.
Yeah, it was like
I was
2
thinking
point-
where it was Santa Barbara, 10 million, and they said
They
that
went down, and we've done a lot of work. I know
60,000
Tracy's
or
looking
something.
at me. Most of their finding had to do with payroll. We were under the summer salary, the 2-month summer salary rule for the bulk of the time period that they were looking at. And so we've been fighting that. I think we have a really strong argument and case that they should drop all those findings. However, this is OIG, Office of Inspector General, and once they have it in their head that they need to make this a finding, they will probably keep it. Other findings that they're looking at are some equipment that was either purchased at the end of an award, in some cases even after the award period ended, or also equipment that wasn't in the budget. So, and then kind of your typical things, cost transfers. I think they had some computers that they questioned kind of a while ago now that we really worked on this. I don't actually remember all of the details. And so nothing on that. NSF has kind of come through and done some very small and focused reviews, but nothing major. California Department of Food and Agriculture, if you have any specialty crop block grants, CDFA continues to do their desk reviews. They just are completing 5 desk reviews. And what that is they'll select an award and they'll select a specific invoice that we've sent them for reimbursement. And then they just request all of the supporting documentation. Let me talk about supporting documentation just for 30 seconds. Please, when you're providing the supporting documentation, whether it's vendor invoices, travel reports, travel receipts, timesheets, whatever it is, please just make it in some kind of order so we make it easy for the auditor to look through the documentation. We want to make it as easy as possible for them. The easier we make it, the more warm and fuzzy feeling they get about us. That's right. And the happier they are, the happier we are. It's really difficult when I get the documentation and I'm looking at it, because I'll look at it before I send it off to the auditor. I'm not going to really change anything that you've provided me, but I am going to look at it and see if there's any questions or concerns that I might have. And if it's difficult for me, and I know kind of what I'm looking for as far as decision support reports or how some of our information might look, imagine what it's like for somebody who has no idea of our systems. So I just make that plea, organize it, make it easy for the auditors. So CDFA is just finishing a round of 5 desk reviews, and they've just started a new round of 6 more. So they're looking at federal fiscal year 14 grants that they've made. So it's specialty crop block grants.
I think it's time they paid more indirect costs.
I agree, because I think they're 5%. That's one of the exceptions to the exceptions to the exceptions or something. U.S. Forest Service has, they're coming on site to do site visits. It's either of 2 or 3 awards. They haven't quite decided. And U.S. Forest Service has different divisions within themselves, and so they're each doing their own thing. So not much to say about those, except they're very intense, and they really want a lot of administrative information, your policies, procedures. So campus-wide, I can provide that, but then departmental policies and procedures, that would need to come from you. And they're going to look at those, and then they're going to look at some supporting documents, and they're going to make sure that you're doing what you've said in your procedures. And then the last thing I really want to talk about is foreign projects, or projects that are taking place in a foreign country. As we, as a campus, increase our global footprint, so do our projects. I think we have probably more and more. I don't even know a number. Do we have any idea how many projects that are sponsored actually in foreign countries? It's getting to be a lot. And they could be sponsored by a U.S. agency, or they could also be sponsored by a foreign government. And so I'm seeing a small increase in audits about that. So USAID likes to come in once in a while and do a big audit. But then we also had a foreign government that gave some money to sponsor a center we set up in their country, and they sent some auditors. And so there's some risks and challenges with a project that's taking place in a foreign country. So just be aware of those. Read the award. I think it's great. I'm like a big fan of quality assurance, but don't rely on always others to point out like some very specific terms and conditions. Really look at those awards. For instance, with the USAID recent audit, there was some pre-approvals that seemed obvious. They wanted pre-approval for foreign travel. Okay, project takes place in a foreign country. Scope of work says we're going to do it there. We have budgeted money for foreign travel, but yet they wanted a secondary, after the executed award, another approval for foreign travel. It was stated in the award, but so really look at those things. There was another pre-approval. Oh, it was something that actually was in the scope of work. It was who was going to head the project. It seems pretty obvious. You approved the scope of work, you funded the project, but yet we had to then, it was a retro really request for an approval. So just look at those things. Just important. Well, and I guess the only other thing I would say is that there are challenges also with what a foreign country or a foreign auditor accepts as supporting documentation. And just the biggest example I can say is with travel. If somebody takes a plane, our supporting documentation is the purchase of the airline ticket, right? That's our support. They wanted to see the boarding pass. They wanted to see that we just didn't buy the ticket and return it. They wanted to see that we actually boarded that plane. So, I don't think that'll be an issue because we were allowed to follow our federal guidance when it came to spending the funds. But I would definitely look at the agency's guide, to how to administer the award. And there may be some little nuances in there that you might want to pay attention to.
Okay.
So that's my update. Are there any questions? I don't know. Okay, well, thank you.
Thank you very much. Well, we are approaching 10 o'clock. Any questions for any of us or any issue that you'd like us to talk about? No, if not, then you know that we have the open house that the team has put together. So if we get a quick break and we go from there.
Yeah, please do